Did you know that breast cancer is one of the most common and potentially dangerous cancers women can face? According to the American Cancer Society, it's the second leading cause of cancer-related deaths among women. In fact, about 1 in 8 women will receive a breast cancer diagnosis at some point in their lives. It's estimated that in 2024, over 300,000 women in the United States will be diagnosed with breast cancer for the first time, and more than 40,000 women will lose their lives to it. The good news is, if detected and treated early, breast cancer is much less likely to be fatal. One of the most common and noticeable signs of breast cancer is the presence of a lump in the breast or underarm. But what should you be looking for exactly? When performing regular breast self-exams, it's crucial to become familiar with the natural feel and appearance of your breasts. This way, you can quickly spot any changes that may occur over time. Lumps can form both in the breast tissue itself and in the lymph nodes in the underarm area, and both should be carefully checked. Not all lumps are cancerous. Many are benign, such as cysts or fibrocystic changes. However, a lump that doesn't go away, changes in size, or feels different should always be watched closely. Pay attention to how the lump feels, whether it's hard, irregular, or fixed to the tissue, which might require more investigation. Additionally, it's important to remember that a lump doesn't have to be painful to be concerning. Even painless lumps could be a warning sign. Now, moving on to another important change you may notice, your breast shape or size. But first, hit that like button and smash the subscribe icon. Changes in the shape or size of the breast can often go unnoticed, especially if they occur gradually. However, any noticeable difference between one breast and the other should never be dismissed. Breast cancer can cause the tissue to grow in a way that alters the breast shape, size, or symmetry. This may result in one breast becoming larger or more misshapen than the other. You may also notice that one breast feels firmer or different in texture compared to the other. It's important to look for both subtle and more obvious changes. If you see that one breast has become unusually swollen or that the skin appears pulled or stretched in one area, it could be a sign of something wrong. The skin might feel tighter, or the breast may seem to dimple or have an unusual indent. Any changes in size, especially if accompanied by pain or discomfort, should be carefully observed. Speaking of skin changes, another concerning sign is dimpling or puckering. Dimpling or puckering of the skin on the breast is another important sign to watch for. This condition often happens when cancerous cells invade the connective tissue in the breast. When the tissue is affected, the skin can begin to retract, leading to a dimpled or orange peeled appearance. The dimples are often more noticeable when you raise your arms or move in certain ways. The reason for this puckering is the way the cancer cells interfere with the skin's natural elasticity. As the tumor grows, it may pull the skin inwards, resulting in noticeable texture changes. If you notice any dimpling or a lumpy, thickened appearance of the skin, you should not ignore it. Even if the skin changes don't seem to cause any pain, this could still be a signal that something is wrong. Now, let's talk about a symptom that's easy to overlook but could be important: nipple discharge. Nipple discharge that is not related to breastfeeding is a symptom that should always be taken seriously. While some women experience nipple discharge during pregnancy or breastfeeding, any unusual discharge outside of these times can be a warning sign of an underlying condition, including breast cancer. The discharge could appear in various colors, such as clear, bloody, or even greenish, and may come from one or both breasts. Any unexpected discharge from the nipple, whether it is spontaneous or occurs only when you apply pressure to the nipple, should be noted. Bloody discharge is particularly concerning, as it can indicate that cancer cells are affecting the ductal system of the breast. However, other types of discharge, such as clear or yellowish fluid, are also significant and should not be dismissed. Now, let's focus on a subtle change that's easy to miss: inverted or flattened nipples. An inverted or flattened nipple is another subtle, yet significant sign of breast cancer. Normally, the nipple protrudes outward, but if you notice that your nipple becomes retracted or pulled inward, it could be a sign of something serious. Inverted nipples that appear suddenly or have changed shape over time should be observed. This is especially true if the inversion is new or occurs in only one breast. The change in nipple shape occurs because of cancer cells that grow behind or around the nipple, causing it to retract. The tumor may be pulling on the tissue, making the nipple flatten or invert. This symptom can be isolated to just the nipple, or it can be accompanied by other signs like pain, swelling, or redness in the surrounding tissue. Next, let's examine the skin changes that can signal something more severe: redness, scaling, or thickening. Redness, scaling, or thickening of the skin or nipple is an important sign that could indicate breast cancer. In particular, a condition known as inflammatory breast cancer presents with redness, swelling, and changes to the texture of the skin or nipple. Inflammatory breast cancer is a rare but aggressive form of cancer that causes the breast to become red, swollen, and warm to the touch. The skin may also take on a textured appearance, similar to an orange peel, and can feel thickened or inflamed. This symptom occurs when cancer cells block the lymphatic vessels in the breast, leading to fluid buildup and skin changes. If you notice that the skin on your breast is red, irritated, or starts to peel or scale, it's critical to stay aware of how the symptoms progress. These changes can also be mistaken for a skin infection or irritation, but it's important to observe the signs and take note of any other symptoms you might experience. Finally, let's discuss a common symptom that can sometimes be linked to cancer: persistent pain in the breast or nipple. Persistent breast or nipple pain that doesn't go away over time is another symptom to watch for. While many people experience occasional breast pain due to hormonal changes, injury, or other benign conditions, persistent pain that lasts for weeks or months should never be ignored. The pain may feel like a dull ache, sharp shooting pain, or even a constant throbbing sensation. If you notice that the pain doesn't subside with time, or if it worsens, it could be a sign that a tumor has started to affect surrounding tissues. Although breast cancer often doesn't cause pain in its early stages, persistent pain can be an indication that something more serious is happening. This pain could be localized to one area of the breast or nipple, or it could spread throughout the entire breast. These 7 signs are important indicators to watch for, and staying aware of your body's changes can help you stay on top of your health. Now that you know the symptoms, both common and surprising, that could signal breast cancer, it's time to take action. Whether it's a lump, skin changes, or nipple discharge, recognizing these signs early can make all the difference. Early detection is one of the most powerful tools in the fight against breast cancer, so don't hesitate to get checked if you notice anything unusual. Don't forget to like this video if you found it helpful, and subscribe to our channel for more health tips and vital information to keep you and your loved ones informed.